Insulin's job is to store energy. Okay, it is not to keep your glucose normal, it is to store energy. It keeps your glucose normal as a function of storing energy. If you're storing energy, you're going to gain weight. In addition, insulin stimulates a different pathway in cells, that is the proliferation pathway. It's called MAP kinase and ERK. This pathway is responsible for vascular smooth muscle proliferation, coronary artery vascular smooth muscle proliferation, thereby making your coronaries tighter and less likely to be able to vasodilate when they need to, thus increasing risk for heart attack. It also causes cell division because insulin is a mitogen. It causes cells to divide. Well, if it causes your breast cell to divide, you might end up with breast cancer. And so hyperinsulinemia is associated with all of the chronic metabolic diseases we know about because of this second phenomenon that insulin does, not just lowering glucose, which it does as a sidelight of storing energy, but in fact because it causes both inflammation and cell division.
My hope is that as time goes on, more and more physicians will realize that hyperinsulinemia per se, independent of what's happening at the level of glucose. In other words, you have a patient with a quote-unquote normal hemoglobin A1C, but they're hyperinsulinemic,
right,
that is taken as seriously as we would take diabetes.
Absolutely. And this is one of the reasons why, if you look at all of the diabetes studies that are out there in terms of diabetes control, they all improve hemoglobin A1C, and the patient dies anyway. The UK-PDS, the Accord study, and several others all show that you can lower blood glucose, you can reduce microvascular complications, diabetic retinopathy, neuropathy, nephropathy, all small vessel complications by lowering the glucose. But what you do is you exacerbate the large vessel complications like coronary heart disease or cancer. And you end up dying just the same. So getting your blood glucose down is only half the job in diabetes. Getting your blood insulin down is the other half. And taking drugs that increase your insulin ain't the way.
Yeah, it's a backwards way to go about that.
It is totally. The object is to increase your insulin sensitivity. And the only way to do that is by diet, not even by exercise alone. You can't outrun a bad diet.